York, New Jersey, Connecticut, and Pennsylvania, we think roughly we're going to need $100 billion of direct cash assistance to help us get through this emergency to be able to recover.
The global epicenter of the COVID-19 pandemic switched from China to Europe and now to America, specifically New York and New Jersey, which are the two hardest hit states. We wanted to talk to people about what's actually happening on the ground in those states. So we're going to talk to Governor Murphy today about what's happening in New Jersey. They just announced that Bergen County has more cases than all of South Korea. So we're going to talk to him about what's happening today and what he sees as the solutions going forward. Governor Murphy, thank you for your time today.
Honored to be with you, Shane.
I know you're a very busy man, and we appreciate the time, so I'm just going to get started. It's recently been reported that Bergen County has more COVID-19 cases than South Korea. And this stat, to me, is staggering because South Korea was early hit. It was, close to China. It was one of the countries that we were watching. And they seem to have flattened the curve. And how can a whole country flatten the curve, but a county can't?
It's a great question. Bergen County is the hardest hit county. We have 21 counties in New Jersey, and there are 5 or 6 that stand above the others in terms of the number of tests and the number, sadly, of fatalities. And Bergen County is at the top of the list. And for the folks who don't know the geography in New Jersey, we're talking the northeastern and central eastern counties that are basically part of the New York metro area. That's the reality. I would love, please God, would love to have had universal testing right out of the blocks with the materials necessary for that. We haven't been able to have that. And we've been hit by a tsunami here, and we're still trying to get back on our feet. The curve is starting to flatten, but we're still right in the middle of it.
As we see this happening, Black and brown communities are being more adversely affected, as well as economically disadvantaged communities. How do you mitigate that?
Yeah, so that's the case in New Jersey, in particular with the African American community. The data on the Latino community is a little murkier, and these are early days, but it looks to us as though the fatalities, at least among the African American community, are running about 50% higher than the African American representation in the broader society. And that's obviously an area of enormous concern. We have a long-standing posture, whether it's education, housing, healthcare, in place to try to redress some of the centuries-old challenges that the African American community has had here, but we are not perfect. And whether it's addressing homelessness, the nature of housing and the actual density of that housing, lack of access to proper health care. We've tried to stay out ahead of all of that, but it's a sobering lesson that that's a work in progress at best. And our African American community, in this case, is paying a price for that.
You don't have a crystal ball, I realize that, but millions of people are watching this and saying, okay, when do we reopen? What is the plan? What are the steps to get back to work? What are the steps to get back to rebuilding the economy? Each day that goes by, is more and more detrimental to millions upon millions of Americans. What do you say to them? And I know this is a very difficult question, but what do you say to them okay, this is what we're going to do, and this is our plan going forward?
The most important thing I can say is we understand your pain. I mean, the unemployed in our state has exploded. Over 500,000 claims in the past 3 weeks alone in a state of 9 million people, to give you some sense of the scale. The devastation in our small business community, just to pick 2 examples. So we get it. And we had, since January, sort of 2 options. One is to let this thing run wild like a runaway freight train, or alternatively try at every step to stay out ahead of it, rip the Band-Aid off as an economic matter, and that's incredibly painful, but to stay out ahead of it, and we're still suffering. I think the crystal ball, as best as I can tell, is the next couple of weeks in New Jersey are going to be really hard.
You talked about reopening. The federal government's talking about reopening the economy, and you've said that can't happen without more cooperation between the Fed and the states. What do you mean by that?
On this one, Shane, I feel with great passion, and I'm not a medical expert or scientist, but we've been meeting on this since January. I formed our whole of government task force, I think on February 2nd. And I know this, we need as complete a healthcare recovery as is achievable. And then we can have only then an economic recovery that builds on the back of that. And I know that's the sequence. Now, I don't know what the timing looks like. I wish I did. I saw what Governor Newsom said yesterday in terms of a framework, which almost overwhelmingly I would say we endorse, but he also was open-ended to timing.
There's no light switch here. I would argue it's more like a dimmer. And that dimmer is about what I was talking about, this toggling back and forth between more restrictive and less restrictive measures.
I'd love to say it's tomorrow or next week. I just don't see it right now that we can reopen.
You recently, and I'm going to quote you here, said, if we stop doing what we're doing, COVID-19 can boomerang on us. What do we do to stop that trajectory from happening? How do we stop that if we look back at history and say, well, the closest thing is the Spanish influenza, and this is what happened there? How do we stop that?
Again, Shane, accepting that I'm not a medical expert, but based on everything, and I've spoken to everybody from Tony Fauci to every expert we can find in New Jersey, around the country, around the world. This is my brief answer. Get the darn virus the first time at least snuffed out, or as close to snuffed out as you can. Make sure you've got the healthcare infrastructure in place, in particular, rapid scale turnaround testing and contact tracing. Open your economy responsibly, how you configure your schools, what's a bar or a restaurant look like, et cetera. Next, I would hope that there are some amount of therapeutics that would be coming on stream at some point. I hope, based on conversations I've had at least, and again, I'm not a medical expert, in the fall, winter, and then that elusive vaccine that folks talk a year and a half from now. So I think it's a combination of all those things. And by the way, while the curve of positive tests, Shane, is flattening in New Jersey, it hasn't plateaued. So I just got today's numbers and they're up again. They're up at a lower percentage, but we got to not only plateau, but we got to drive the curve down on the other side. There's a lot of promise coming out of places like Rutgers, our state university, for things like saliva tests in scale with quick return, and then very much in place contact tracing steps, and then therefore quarantining, isolating strategies. All of that's going to have to be in place to give us any amount of confidence that we can begin to turn the lights back on. And I like what Gavin said. It isn't a light switch. I think folks should think of it as one of those dimmers, and it's a question of degree. And that's what I think the reality will look like. My hope would be that in the summer months, we can get some sense of a new normal reality here. That's my hope, that we can begin to see some normalcy in the warm months here in New Jersey.
New York and New Jersey are the global epicenter of this pandemic. How in God's name did that happen?
I mean, it's a national failing. I don't know how long it was baking, but it's a national failing. There's just no other way to put it. The meter is running. We need to continue to be at the point of attack, and we need the federal assistance to allow us to do that.
You've been critical about the lack of testing. Why didn't we have testing? I mean, South Korea, was heavily into testing, continually, and contact tracing. We're just getting to that now. And it seems to me that we saw what was happening in China. We saw what was happening in South Korea. It was coming towards us. We were watching it come towards us. And now New York and New Jersey are the global epicenter of this pandemic. How in God's name did that happen?
Yeah, I mean, listen, we're gonna have to not only figure that out so that we don't live through this again in another pandemic, but we better darn well figure it out if we have any hope to reopen our economies anytime soon. I mean, it's a national failing. I don't know how long it was baking, but it's a national failing. There's just no other way to put it.
We're running out of medications, we're running out of equipment, and we're even running out of oxygen, which is something that patients that have COVID-19 need.
But if we're going to be opening our states back up or our country back up, the testing reality has to get to a completely different place from where it is as we sit here today. We got to figure out how we went into this as a nation. and frankly, as states, but in particular, I think as a nation, in the state of preparedness that we were in relative to where we should have been. And we're going to have to figure out those tough lessons and make sure we don't relive history again going forward.
We talked to Governor Newsom from my home state of California recently, and he said that the current crisis shows the limits of federalism.
Clearly, federalism has its limits, and I think if there's an opportunity to think anew and act anew, it's clearly going to be post this challenge to make sure that we never have this kind of isolated response again, that we truly have a global response first and then a federal response that can meet the moment.
Would you agree with that statement?
I think he's probably right. By the way, he's doing a great job. You know, you don't turn to any shelf like the one behind me and pull down the COVID-19 pandemic playbook. Let's see how we did it last time. And so everybody's going through this for the first time. I don't think it's either or. I think you need really strong state and local leadership right now, but there is nothing, no matter how good or how strong that leadership is, there's nothing to replace a robust, full throttle, big federal response and partnership. There just isn't. Whether it's a healthcare crisis, an economic crisis, an act of war, whatever it might be, as good as any state and its leadership might be, there's no substituting the big indispensable role that the federal government can play.
A lot of people we've talked to have said, look, this is a wake-up call for structural inefficiencies, for societal problems. Do you see this as a political catalyst for, hey, look, we got to fix these things?
Yeah, I haven't really thought a whole lot about it through a political lens, even though I'm an elected official. I'm chair of the Democratic Governors Association. To be honest with you, it's war, and we've been fighting it as a war. But I think it's got to have dramatic, and I would use the word dramatic, implications of how we do business as a policy matter, as a country, and as a state going forward. And I would have thought it would bring the world, frankly, if done right, closer together.
And that's what we're doing. We're opening up our country.
What are you going to grant me what the Constitution gave me before you were born?
I fear right now that we may be splintering, and I think that's probably the last thing we need. But I have to believe, Shane, that the implications at a policy level, healthcare, housing, transportation, education, are profound. Historians will look back 100, 200 years from now and say that this was an inflection point in our nation's history, maybe the globe's history, almost unlike any other.
Governor, thank you for your hard work, and thank you for your time today.
Thanks for having me, Shane.
The current crisis has thrown a spotlight on the Centers for Disease Control, the federal agency charged with tackling crises like the COVID-19 pandemic. So we called Dr. Richard Besser, a former head of the CDC, to talk about which communities are hardest hit and the importance of science in public life. I know you're a very busy man, so let's jump right in. When you were head of the Center for Disease Control, or CDC, you said that it's important for politicians to trust the CDC. Why did you say that, and do politicians inherently not trust the CDC?
When you're dealing with a public health crisis, what you know early on is very small. And what you want is to be doing public health science to get answers to the critical questions. And you want to know that the political leaders who are behind you believe that science can pave the way to protecting society and that they have your back. You know, I remember during the H1N1 swine flu pandemic in 2009, and I had gone up to Washington to brief the president and the cabinet. And one of the first things that President Obama said during that is that we want everything we do, everything, to be based on the best available public health science.
We are closely monitoring the emerging cases of swine flu in the United States. The Department of Health and Human Services has declared a public health emergency as a precautionary tool to ensure that we have the resources we need at our disposal to respond quickly and effectively.
You know, that didn't start with the Obama administration. All during the Bush years, there was big concern about bird flu. So we were preparing, and we were holding summits in every state across the country. We were filling up the stockpile with materials that we might need, and we were rehearsing. We would go through dry runs for what we would do during the first days of the pandemic several times during the year so that we would be ready.
It seems like in America, especially, we weren't prepared for this. We still don't have testing. We still didn't get out in front of it. Why?
Yeah, that's a good question, and I think a lot of that is food for an after-action review in terms of where there were breakdowns. Here with this coronavirus, the test that first went out didn't work. But I have to say, I was never involved in a response where we didn't try something and have a big failure and try something else.
An outbreak of swine flu south of the border threatens to become a pandemic.
We're responding, and we're responding aggressively to try and learn more about this outbreak and to implement measures to control this outbreak.
When the swine flu pandemic hit in 2009, we got lucky to some extent. We had been doing a lot of test development for animal strains of flu. And so when this swine-related strain came available, we had a test that we could roll out very quickly to state labs. Back then, I would have daily briefings with the public through the media. And because of that, I could explain what we knew, what we didn't know. And when something didn't go right, I could explain it. I could say, we tried this, it didn't work, we're trying something new.
I think we're going very quickly now. I really believe. I think we're going to have a lot of states open relatively soon. We're beating the date. I said a date of May 1st, and here we are. And I think you're going to have some nice surprises over the next few days.
Science is only one factor that goes into a policy decision. One of the challenges when the lead communicator is the White House is that it makes it very hard for the public to know what's being said because it's the best science and what's being recommended by the experts and what's being done for political or otherwise policy reasons. The public has to see transparency around that. It just blows my mind that as the wealthiest nation in the world, we accept having a safety net that is in tatters.
One of the things that was an unforeseen consequence, or maybe a foreseen consequence, you can tell me, is the sort of how badly this virus has hit the Black and brown community in America and economically disadvantaged communities in America disproportionately.
There are so many reasons why Black Americans are getting hit hardest. If you look at the condition in America before the pandemic hit, people of color, people in low-income communities, rural Americans, people with disabilities, their ability to lead a healthy life was far below that of others. When you superimpose on that a pandemic, what we're seeing now is totally predictable. You've got higher rates of chronic diseases, heart disease, lung disease, respiratory diseases. A lot of that has to do with environmental conditions in low-income and communities of color where air quality is not as good. You have more people who are working as hourly workers who can't work remotely. And so if they want to put food on the table or pay rent, they're going to have to go out more and get exposed more. You may have higher density of people living together. And we know that close contact is a way that this spreads. And then on top of that, we know from study after study that there's bias in our healthcare system, and people of color face discrimination over and over again when encountering the healthcare system. The CDC numbers that come out in terms of overall confirmed cases and deaths only count people who've been tested. So I would expect that there's actually an undercount in terms of the impact. These are all issues that didn't start with this pandemic, but the pandemic is allowing us to shine a light on them and hopefully work towards long-term policy changes that will address this.
So I think those are good points, and I want to throw them back to you. One is, okay, agreed. How do we make things better in the now for disadvantaged communities? How do we fix it in real time? And then what do we do policy-wise going forward so that this doesn't happen again?
One of the things that really gets me here, Shane, is the issue in terms of access to healthcare and health insurance. Because one of the first recommendations coming out from public health was, we need to take pressure off the healthcare system. So unless you're very ill, if you're developing symptoms, call your healthcare provider. Well, what does that mean for the 28 million people in America who don't have health insurance? Who are they supposed to call? So they're more likely to go to the emergency room. If they didn't have COVID before they got there, they're more likely to pick it up. It just blows my mind that as the wealthiest nation in the world, we accept having a safety net that is in tatters, and a society that really leads to the haves being able to shelter in place with some inconvenience, and the have-nots having to make life or death decisions about whether they go to work or not, or do the things they know would protect themselves, their families, and their communities. And this has got to change.
What do you see as a sort of outcome of this? Is there going to be a societal change, a political change, a policy change? Because it seems like these type of pandemics are not one-offs anymore. They're cyclical.
Unfortunately, I'm a little pessimistic. I became head of preparedness and response the day Katrina hit New Orleans. I remember all of the after-action reviews coming out of that. The words never again, never again. We're never going to get into a situation where we're that vulnerable. We're going to be prepared. Within 2 years, budgets for preparedness and response were going down. People don't like to stay afraid. And one of the ways that they deal with that, and you focus on, all right, what are the problems affecting us now? And if you're thinking about cutting budgets, preparedness and public health infrastructure are things that over and over and over again get cut. It's very easy to let these systems slip. Right now, we see a lot of things that need to be in place so that never again are we in this position when a pandemic hits. Because your point is right. It's not if another pandemic will come, it's when. If you look over the course of history, pandemics have had a way of reshaping society. And there will be an opportunity here to look at our society and think about, what do we want it to look like? What do we feel is important? Do we value everyone in our country the same? And are we going to restructure things, remove all of those barriers that on a day-to-day basis have gotten in the way of people leading healthy lives? Coming out of this, people have to decide what kind of society they want it to be and what it will take to get there.
Dr. Besser, thank you for your time today.
Really nice talking to you, Shane.